I do a lot. I have a very, very active lifestyle: boating, fishing, diving, snorkeling, skiing. I work out at least with weights 5 days a week. I do my cardio, and I love being in the gym. I was born with hip dysplasia and a shallow socket, which I did not know until I was in my mid-20s. I fell, and that all of a sudden started causing extreme pain. So I went to a doctor and they said, yes, you have hip dysplasia and a shallow socket, but because of your age, there's nothing we can do about it because you're too young for a hip replacement and you're too old to have any other kind of corrective surgery.
So Diyna Swiderski is a very young individual for needing joint replacement surgery. Typically we see this in the elderly patients, typically the over 65. They have pushed our indications to the younger and active patient population like Diyna, particularly when they have eroded away their bone and they're having severe bone-on-bone pain.
My pain level before my surgery was very extreme. It limited, I couldn't even walk without flinching, couldn't sleep. I'd wake up in the middle of the night, just lying down bothered me.
Hip resurfacing is a type of hip replacement procedure. It is an alternative to a traditional hip replacement procedure for young and active individuals who will most likely need another surgery in their lifetime. With hip resurfacing, you're trying to maintain the femoral head bone stock. So even though you still do the same thing on the socket side and putting an implant on that side, on the femoral side, you're maintaining this bone stock, shaping the femoral head to receive a resurfacing cap, if you will. It has the advantages of being bone conservative.
The first day they actually had me up and walking with a walker. And after the second day, I said, I'm not leaving this hospital with a walker. Recovery was easier than I thought it would be.
She was incredibly energetic and willing to do whatever it took to get better. I couldn't ask for a more perfect patient.
Dr. Fowble is a very unique doctor. He is very, very well at what he does, and he doesn't sugarcoat things, which is awesome, which I like about him. You know, he will tell you how it is, and you don't have to worry about things because you know that you're in great hands. And basically whatever Dr. Fowble says, you're like, okay, because you know it's going to be okay. So I think he's just I love him for giving me back my life. Some days I felt like I was like walking with a little spring in my step because I was able to get back into the gym and do the things that I wanted to do. And I really, really tremendously enjoyed it.